Hello and welcome back to Ventura County Works podcast, your source for real conversations about workforce innovation, economic opportunity, and community resilience. Today's episode is about healing people, healing careers, and healing our community. And towards that end, we're exploring the VC Heal Healthcare Careers Program, a new initiative that supports free training and wraparound support to help local residents launch careers in healthcare. Of course, with us is Rebecca Evans. Also joining us today is Elizabeth Rubalcava, the operations manager. Elizabeth, Rebecca, welcome.
Good to see you, Doug, and thank you so much for being with us, Elizabeth.
Likewise, pleasure to join you.
Yeah. So let's talk about VC Heal. We're very excited to bring this program to the local community, and let's start at the beginning. What exactly is VC Heal?
VC Heal stands for Ventura County Heal Healthcare Careers Program. It's a workforce training program funded by the Community Development Block Grant Disaster Recovery, and it's designed to support Ventura County's healthcare industry as it was impacted by the Thomas and Woolsey wildfires. The program targets low to moderate income residents and aims to rebuild lives while strengthening our region's healthcare workforce.
So it's part of disaster recovery. And I know that was a very interesting opportunity for us here in Ventura County. These funds were made available specifically for counties in California that experienced the wildfires back during the Thomas Hill and Woolsey fire time period. So, but it sounds like this is not just part of disaster recovery, but an intention to future-proof or prepare our workforce locally for the future.
Exactly, Rebecca. The wildfires in 2017 and 2018 affected thousands of residents, especially in low-income communities. In Ventura County, more than 1,500 homes were damaged or destroyed, and many families were displaced or economically destabilized. At the same time, the healthcare sector here is struggling. We have more than 5,000 job postings annually in healthcare-related occupations countywide, and not enough trained workers to fill those positions. So VC Heal is about creating a direct response to both of those challenges.
Yeah, we want to get into the data and talk about why healthcare is such a priority. I will say it has been a priority sector for the Workforce Development Board because of the need here locally for many years. And also, some may recall, I mean, there were many impacts on our healthcare system as a result of those fires and natural disasters. But a local hospital, Vista Del Mar, burned down during that time. And it was very challenging locally for the workforce as well as for the provision of healthcare.
Absolutely. It was a tragic time for our county looking back. In terms of the data, according to the California Employment Development Department, Ventura County's healthcare and social assistance sector employs over 43,000 people and is projected to grow by 10% over the next 5 years, outpacing many other industries. We're talking about real shortages. So the county health department reported a 35% vacancy rate for certified nursing assistants, CNAs, in skilled nursing facilities. Medical assistant roles are growing at 12% annually, and entry-level wages averaging $20 an hour and increasing with experience. Statewide, 1 in 5 healthcare workers is expected to retire in the next decade, while demand for services, especially home care, is rising with our aging population.
Yeah, that's for sure. So we're facing the pipeline crisis as well as retention, the issue with retaining those healthcare workers.
Yes, and it's especially urgent in rural and underserved areas of the county where access to healthcare is already limited.
All right, yeah, we've faced that for quite some time as well. So let's talk about VC Heal and the eligibility. Who is this program for?
So that's a great question. This program is particularly designed for Ventura County residents. So you must be a resident of Ventura County, 18 years or older. We are looking for folks that have a high school diploma or equivalency at minimum. A little extra education is great to have as we're trying to get as many people trained and into skilled healthcare jobs. We're also looking at citizenship or right to work, and essentially an I-9, what we're looking to satisfy. There are also some income requirements, but this program is unique in that we are able to qualify low to moderate income participants. So for example, a single person making 78,000 in the county is actually moderate because we're in a high cost county. And so we can qualify a lot more people with having that flexibility. And, you know, there are a few other requirements that we can go through, but essentially what we want is to meet with people one-on-one, find out their particular situations, and qualify as many people as possible. And we're targeting a minimum of 250 Ventura County residents. And if we can increase that number, even better. I'd love to double it, to be honest, because the need is so great. So those are some of the requirements. But in addition to that, we also, you mentioned wraparound services, we call supportive services. Supportive services are additional funds available to participants in the program. And we cover things like tuition, books, uniform, certification fees. We'll cover potentially counseling or basic needs assistance to some degree. We do provide a lot of referrals for people who are facing challenges. We understand that a lot of the folks that are coming to us, they may have come through crisis or trauma, as we were talking about the things that happen in terms of the fires and loss of homes, loss of income. All those things have a tremendous impact on individuals and their families. So we offer life coaching. We have on staff a life coach who will work with our participants and help them through barriers they may be facing. Another thing we do is we provide what we call career navigators. They help individuals with their career planning. So if they're just not sure what sector of healthcare or what type of work they would be best suited for, our career navigators are going to help them with that, and also provide case management. So from the time that they're enrolled to the time they graduate from their training course until they're in a position in healthcare, thriving, we're going to be with them from beginning to end. That's the plan.
Yeah. That's incredibly comprehensive, and I think exactly what is needed. Because you're right, whether someone is new to the field, re-entering, or perhaps they lost their employment or their opportunity to go to school in recent years and they're rejoining that, having that additional support to be able to complete the program and move along their career pathway is so important.
Exactly. And we want to meet people where they are, and we want to walk them toward where they want to go. So we definitely, again, are there to support and provide that encouragement along the way and make sure that they are reaching their goals.
That's excellent. So glad to hear it. And I loved hearing you say, I think we can serve even more people through the program. So what kind of careers? We talk about healthcare, and you mentioned where some of the shortages are, but what kind of careers does VC Heal prepare a person to move through?
Great question. We're focused primarily on high demand entry to mid-level jobs and those positions that will lead to long-term career development. So think of a career ladder. We get them in, maybe perhaps in an entry-level position, but they can continue to grow in their education and their experience to qualify for higher paying positions. And so we're looking at home health aides, certified nursing assistants, as we mentioned, the great shortage that we have in our skilled nursing facilities. These are critical positions We know that we need more home health aides for our aging population who depend on home care. Medical assistant is another really popular and thriving sector. We do training in both the administrative side and the clinical. EMT. So if we're looking for someone who say wants to join the fire department in Ventura County, it's sort of coupled with firefighting that you should have training in emergency management. And so that's one of our highlights. Phlebotomy is another area that we want to get people skilled in phlebotomy. It also will make someone more marketable if, say, they get training in medical assistant and have phlebotomy. That will make them, kind of doubly useful in healthcare settings. EKG technician, same thing. We can do dual certification in phlebotomy and EKG and medical assistant, and that again will help those individuals be all the more skilled and ready to help our healthcare industry. Health information technician, which is really sort of an IT type of position within healthcare. A pharmacy technician, we're seeing a lot of interest and a lot of demand, especially we're in a community, in many of our communities in Ventura County have a very large Spanish-speaking population. So we're also looking to, we want to introduce pharmacy technician to the Hispanic community in order to meet the need, because we have a number of pharmacies in the county that really need the bilingual skill set when they were looking to hire. And then medical billing and medical coding is always something that we find is important. But all programs are approved by state regulatory bodies, so they require a license or certification. There's something at the end of that training that shows that they've achieved the necessary skills to perform in those roles. And as I mentioned, these roles are stackable, so we can add EKG and phlebotomy to a medical assistant type of training. And so what we know, though, is that with nursing, if we start with a CNA, it's very easy to progress towards an LVN, a licensed vocational nurse, or an RN, a registered nurse. And someone can really have a very gainful, sustainable employment in a career like that. So those are some things that we're looking to do.
These aren't just jobs, as you said, like these are meaningful careers. Now, what if someone is already in one of these careers but would like to advance and move on to another career? Are they also eligible to participate in the program?
100%. We're already encountering medical assistants who are kind of on a temporary basis working, say, in the Clínicas or the community memorial health clinics and all the different, clinics that we have through the hospital systems. But in order for them to remain in their positions, they need to be certified. So many of our first candidates that we have seen for this program are coming with just that. They're already in the job, but they are looking for certification, or they're looking to add that extra skill set or certification, like I mentioned, in phlebotomy or EKG.
Right. Well, let's talk about access points. Where do participants go to access these services?
So we're countywide. We're available in most major cities throughout the county, but I will say primarily in Oxnard and Simi Valley, we have our hub for our America's Job Center of California. So we refer to them as the AJCC or the Job Center, and anyone can walk into the Oxnard or Simi Valley AJCC and receive support. But we're also housed in many of the human services agencies throughout the county. So Thousand Oaks, Moore Park, Ventura, Santa Paula, Fillmore. And we also are hosted by the Department of Child Support Services out in Camarillo. And also in the libraries in Piru and Ojai, we can occupy some some space there to meet with folks and hold workshops and information sessions out there in the libraries. And that's what we're aiming to do, is really to have a broad reach throughout the county. And in the near future, we will have our mobile job center. And what it will be is a job center on wheels, and will travel throughout the county into some of those more remote areas and underserved areas that we talked about at the beginning. And the mobile job center will be a Wi-Fi equipped, tech-enabled vehicle that offers resume support, career coaching, enrollment help, and job search resources. And it's part of our commitment to bringing services to people and not making them come to us.
That's so important. And it's in alignment with what we've been doing across the programs in the Workforce Development Board. We've taken a data-driven approach to that at the Workforce Board and looked at where service access points are available and where they're needed and where there are pockets of need within the community. And that mobile approach is key, especially when we're trying to reach fire-affected rural communities or communities that struggle with the transportation that they may need. And also, it's just great for outreach, because if you're mobile and you're in the community, you might get someone to come in who hasn't seen other advertising. Maybe they don't know about the program until they see that mobile unit in their community. And then they check it out, that's the entry point. And then from there, they can engage in training, get to work, back to work, or move into an advancement in their career, as we talked about earlier. That's fantastic. So let's talk a little bit more about those services that are available, because I think that's also where the mobile approach really shines. Let's go a little deeper into that. You mentioned case management and life coaching, and you did talk a bit about the life coaching before, but you want to say more about what that actually looks like?
Absolutely. And every participant, as I mentioned, is going to be supported from beginning to end. And one of the things that we do is when the participant joins us and is enrolled, they're paired with a case manager who checks in regularly, provides that career guidance, helps them overcome barriers. As I mentioned, some are coming from trauma or crisis. And so we want to connect them also to the certified life coach who will help them with confidence building, motivation, and planning for long-term growth. So these are all things that I know when I was going out beginning my career, I would have loved to have had a life coach, and now it's just something that is really it's necessary. It's necessary to find people where they are and really help them through that next step. So between our career navigators and our life coach, we also share resources with individuals who are facing challenges such as food and housing insecurities, or who might need counseling to overcome crisis or past trauma. So it's not just about getting a job, it's about building a resilient mindset and being prepared for a brighter future. And I know that kind of sounds hokey, but it really is about that. It really is about getting people the support that they need to be successful in whatever training program they choose and whatever career goal they have. If they are experiencing any challenges and barriers to being successful in the training or even on the job once they've found employment, we want to make sure that they're overcomers, that barrier, that challenge is not holding them back. And so we want to see people thriving, and that really is the goal. So we want to make sure that those wraparound services are providing just that. And again, we are cheerleading for these individuals, and we really want to make a difference in their lives individually, and of course, by way of making their lives better, the county, our Ventura County, our beautiful Ventura County will benefit.
Absolutely. And, calling it VC Heal, it's not just because it's the healthcare sector. It's because healthcare, as you've pointed out, crosses a lot of other sectors as well, including technology and some other areas. But it's also healing our community. And the way you're bringing together all the different resources that a person might need to be successful is so helpful. Because if you are unemployed and down and stressed, you're constantly trying to reach out for different resources and piece things together, and spending your time and the time it takes being worried and stressed about that. Or if you're working all the time, but you're not in a career where you can make ends meet and you want to move into a better job or another career. Either way, having someone help you access all the resources that are already available in our community, and take advantage of those, without us having to reinvent them, but connecting them with housing resources, food resources, anything else that may be taking up time and capacity, so that they can focus on the learning and the growing their career and being successful for local employers. Because employers would love to hire someone who has everything in place already, and they've been utilizing services so that they are better equipped to be able to focus on the job. So doing that is a huge collaborative lift. Who are the partners that we're working with?
We have many, many partners, and many who have the same vision and mission, really, to increase the number of healthcare workers in the county. So we're going to partner with like-minded agencies, whether they're government agencies or nonprofits. We're really focusing on education and partnering with all of our colleges and schools throughout the area. And so VC Heal has a variety of partners, from the training providers that we're making agreements with to provide that training to the participants of our program, to the government partners who may be providing the wraparound support and giving those individuals who need additional resources to have success in the training programs. That's what we're looking for in our partners, is how can we together help individuals be well in total, in all aspects, of their person. And so that they're not just getting trained and in a job, but they're also thriving as an individual. And so we are looking to establish additional partnerships as well. We're also hoping that the time that we're spending in the schools, for example, will open doors for a younger generation of workers. As we know, we talked about the upcoming retirements of existing healthcare workers and how that's going to have an impact on us. Well, we get our younger generation to come into these roles and begin to get the skills and training, that we can replace what we're losing and also add to the growth. But we're targeting demographics in all stages. So it could be a single mom. It could be someone who's a little bit older and had a career, but is wanting to start a new thing, and maybe they want to find meaning in the work that they do. I know personally, that's my story. Having come out of a long career in government as a civil servant, and now kind of post-retirement realizing, hey, I want to do something that's more meaningful and help people. And that's, personal for me, but I also don't think I'm alone in that. I think that there's a lot of other people that desire that. And so those are just a few things I would say about moving forward, moving this program forward with our partners. We don't want this to be a secret. Like, we want this program to be known by all, that there is an opportunity for no cost training. And I don't think I said that at the beginning, which really is important. This is no cost training. It will not be something that someone has to pay back. It's not like a student loan. And in addition to that, the individuals are also getting these wraparound support services, plus assistance with job search, and those are vital things to have. And if we can get the word out through our partners, and I can tell you that a lot of our partners, our training programs that we're already connected with, they've been fantastic in spreading the word to folks that are knocking on their doors, and they're sharing about VC Heal. And so it's sort of a domino effect, and by word of mouth, we're hoping that this news is going to spread, that VC Heal is available for all Ventura County residents.
Yes, yes, absolutely. I think that's an excellent point. And I want to emphasize the point that, we're talking about who will enter the program, and the what we typically refer to as a job seeker, or someone who's looking to get healthcare training and move into a career, or move up in their career, or move along into another area. They may be in a good healthcare field right now, but they would like to fill another role, and they need additional training to do that. But this also, as I've said before, it's important for the employers and therefore for the communities. We are all patients of the local healthcare system. Wherever you get your healthcare, you're relying on a trained, ready, and able person to provide all the different segments of healthcare that you need. And our local clinics and hospitals and service providers are counting on us strengthening that workforce. So our ability to use these recovery dollars to offer this training at no cost is going to benefit everyone. So let's say someone's ready. Someone's listening to this, or someone's hearing this, and they know someone who is ready to check out these healthcare training programs. What do they do?
Well, we encourage them to come visit our website, and I'll spell it out, and then I'll explain a little bit more. So we're asking everyone to go visit https://workforceventuracounty.org/VC-HEAL. So that's workforceventuracounty.org/VC-HEAL. That website has all the information that's needed. There's an interest form, and you fill out that interest form, and it's just a few questions, like 6 or 7 questions. And we receive that form, and a staff member of ours will reach out to schedule an orientation and an intake appointment and determine eligibility. And then at that point, we will guide individuals into those training options. Or they can walk right into our AJCCs that I mentioned in Oxnard and Simi Valley and all the different access points throughout the county. They can do that Monday through Friday, 8 to 5. And so we encourage everyone. We're also distributing flyers and information with a QR code, little postcards. We're at job fairs. So anytime you see a job fair in your area, chances are VC Heal is going to be there. And so we're hoping to reach people in the community. Eventually, we will have our mobile job center, the minibus on which we're going to go around to the communities that can't go to our AJCCs, and we're going to spread the word. And again, we don't want this to be a secret. We want everyone to know about this program. And we look for those who may be listening right now, that you hear about this and you think it's a great opportunity, please share it. We're on social media. We are really putting the word out through all of the different media channels, as well as through the Ventura County Star. We've had ads in the paper. We've been on radio, and we've done a lot to try to promote. But we really, again, want to make sure everyone hears about this and takes advantage of the opportunity.
Absolutely. Thank you for that. And even if someone's unsure if they qualify, they should still reach out. So that long web address that Elizabeth shared, you can get there from workforceventuracounty.org. That's our web address. We share it all the time, but it is something to remember. But if you go to workforceventuracounty.org and look up VC Heal, you'll get there. Or you can go to workforceventuracounty.org/VC Heal, and you'll get the information there. You can also call our job center. You can walk into our job centers in Oxnard or Simi Valley, but you can also call us at 648-WORK, 805-648-WORK, which spells out to 805-648-9675. And that's what I was looking up just now, is like, let me make sure. I've said it so many times, but I want to make sure I remembered. So it's 805-648-9675. If someone just wants to call and say, I'm interested in the VC HEAL program, I'm interested in that no-cost healthcare training.
Well, this has been wonderful. Elizabeth, thank you for your leadership on this very important topic. And, Rebecca, as you were saying, the healing part is more than just, yes, we absolutely, we define the problem. And I think anybody who interacts with the healthcare system knows, has experienced some of the issues talking about today. But, overall too, that, the healing being one of recovery and equity, and opportunity. So again, thank you so much. Always a pleasure. Elizabeth, Rebecca, thanks for a great conversation and sharing your words of wisdom on this important topic.
Thank you both. Thank you, Rebecca. Thank you, Doug. It was a real pleasure speaking with you.
Thanks, Elizabeth.